Hello, everyone. Thank you for joining us. My name is Mirna. I'm the co-founder of Elggo, and we have this session today. Very excited about it with Dr. Khaled Kadry, who is a consultant, child and adolescent psychiatrist, and the medical director at Sakina for Youth. Welcome, Dr. Khaled.
Thank you, Mirna. Thank you very much for the invite.
Thank you. We decided to shake things up a little bit today, and instead of just doing a presentation by Dr. Khaled, we're going to have more of a conversation to tackle mainly the stigma around children and youth in the region and how we can overcome it within the home and within a school context. Just to give a little bit of background about you, Dr. Khaled, can you tell us a little bit what drew you to work with children and adolescents, and especially in the field of psychiatry?
So thank you very much, Mirna, and thank you for the opportunity. I just wanted to check from the outset, are people happy for us to do this in English, or shall we do a hybrid of English and Arabic, or shall we do it all in Arabic? I'm happy to go with what you think is most appropriate and convenient.
Yeah,
English, please.
yes, I believe we have a lot
All right.
of
Good. All right. So, good question. So actually, I started off, it's as a medic, everyone dreams of going into medicine and then becoming a brain surgeon at some point. I ended up working in the brain, but not in the field of surgery. But actually, I did start off as a plastic surgeon at some point, and then found that mental health and working with people at that level really cuts across all other disciplines. And I think the thing that I've been blessed, I think, and privileged is to have worked in the field in different cultural settings and different contexts. So one might argue that a broken leg is a broken leg in the Middle East, in the States, in Japan. But depression looks very different in the Middle East, possibly than it does in Europe and sort of the West. Now, and I think that personal touch and that personal flavor, where medicine meets culture, meets individual difference and variability, is something that really appealed to me, and I found really excited to work with. So that's why I went into child and adolescent mental health.
That's very interesting, going from plastic surgery to mental health.
It's a different story.
So based on your years of experience, especially when it comes to MENA youth and mental health in the region, we know there's a lot of stigma. Like, can you share, a story that you have faced on how stigma has affected, the well-being or overcoming challenges for a specific student or youth or child during your experience?
So look, when we see young people and families, for that matter, that present with any sort of challenge or difficulty, we will always see things in a systemic way. So you will always think of variables or factors related to the young person, things that might be related to the family, things that might be related to the immediate society, and then the culture at large or the society at large. And so at every step or at every layer, if you will, of those, there would be reasons why young people might then be reluctant to open up, for example, to their parents. Or if they open up to their parents, the parents might then be reluctant to seek the right support for their children. And when they do, so there's almost bottlenecks along the way of why it can sometimes be challenging and difficult for young people's voices to be heard. So, for example, we would sometimes see young people who come in and open up to therapists or professionals in the containment of that setting. And they would say, well, I didn't want to tell my parents because it will devastate them to know that this is happening. So in a way, it's the young people protecting their parents, or I'm worried that if I open up that they will blame me, or that they might not understand, or that they might take drastic measures, which then puts the spotlight on the young person, certainly in situations of trauma and so on. So a lot of young people will then harbor and live with difficult feelings and difficult incidents as a way of not really understanding or maybe feeling comfortable to open up and share that with people around them.
Yeah,
Now,
but how do you overcome this? Like how do you manage this when, a child comes to your office and then, they're afraid of opening up to their parents because it might devastate them or something else. Like how do you address this? How do you deal with it? Like what are some strategies that you usually use?
sure. The point I was going to make, Marina, is like anything in medicine. If you know, the one of the things that is universally accepted is early intervention if yields better results. So today, if my tooth hurts or I have an achy knee or joint and I address it straight away, I'm almost certainly going to have better outcomes than if I leave it for 6 months or a year. And often we find young people leaving things for years before it becomes formally addressed. And there's so many different reasons why this might be the case here. So early
Yeah.
intervention is key. And I think the thing that maybe we could have addressed early on and taken us, 6 to 8 sessions for argument's sake to manage. If you leave it then 3 years on and 4 years on, there's then other variables that come in that might make then the intervention just a bit more longer and more intensive. Now,
Yeah.
your question about how we manage when young people opening up to their parents, I think it's essentially possibly a misconception of, when you go and see an eye doctor, you know exactly what's going to happen. If you go to see your dentist, you know exactly what's going to happen. If you go and see a therapist or a mental health professional, you're not entirely sure what the process is. You're not entirely sure what the assessments is going to look like, what the rules of engagement, if you will. So we will spend the first couple of sessions essentially engaging the young person, gaining their trust, building that therapeutic rapport or alliance with the young people, um, setting out the framework of what is it that we can do and what is it that we can't do. And we will always be guided by what's in it for them. So the key bit, and I think, is if we don't have that bit, in my opinion, then you really have nothing after that, which is engagement and buy-in. So if the young person comes in and they struggle to open up or they don't trust the system, we don't have any x-rays that show us a broken foot or blood tests that show us thyroid levels. Essentially, therapists are the investigating tool. And so how I can calibrate that in order to see a better picture for the young person is key to then engaging them and getting to where we need to get to. Yeah.
Yeah, do you feel like there's more awareness right now, with the new generation on mental health? They are more equipped, like they know, what are the notions of mental health or their well-being, or what are the different challenges they might face. No, we have seen, through our work at Elggo that a lot of these youth use, anxiety and depression so loosely, right? Like they know the concepts, but have you seen that trend within, your clinical work now?
So yeah, I mean, you might know I have two daughters. They're 13 and 9, and they will come to me every day because they know what their daddy does. So they will say, "Oh, I think this person has ADHD, and I think this person has autism, and I think this person," and they're not, So I think the pendulum has swung maybe at the time of my generation or maybe before, where almost mental illness didn't exist, unless you were really unwell. But there was certainly, growing up in school, I don't remember as much conversation around anxiety and depression, and certainly I didn't know anyone in school who self-harmed and so on. So I think the pendulum has swung from we don't talk about mental health to maybe an over pathology of life, that everything has now become depressing and I'm anxious and I'm triggered and now this is not to say that this is a bad thing, but I think there needs to be the pendulum needs to rest in the middle where we differentiate what is day-to-day hardship in life? What is that it's okay to feel sad that you've broken up in a relationship. It's okay to feel worried if you're going to perform on stage. There's no expectation that you go through all of those, certainly in your adolescence, that you go through all of those stages with a neutral sort of affect. There will be ups and downs, and I think that's what gives life a bit of spice and taste, yeah.
Yeah.
So from our end, what we would then classify as something to do something about is, the technical term is functional impairment. So if my mood is such that I am now so low that I'm not looking after myself, and I'm not looking after my personal hygiene, and my energy levels has gone down, I'm no longer finding enjoyment in things I used to previously enjoy, my appetite and sleep are affected, and it's having an impact on my work, then this is definitely something to do something about, and that would then come under the umbrella of depression rather than I'm just having a couple of rough days. And
Yeah.
so cutoff is how much of what I'm experiencing is having functional impairment on my day-to-day life and functioning.
Mm. Yeah, that's why I believe like awareness is so important right now, because we have this pop psychology coming up with social media where everybody's using all these different terms, but they're not evidence-based. So how do we connect both and make sure that kids understand, this is not depression, like I have a functional impairment that I can deal with in a better way. Just to go back a little bit, like, and to learn from your experience, what are, like, in your opinion, the earliest ways that stigma shows up in children? Because usually we think, kids that are 6 or 7 or 8 or 10, they're not feeling, any challenge, and there's a stigma against it. Like we always tell them, the language we use is "you're fine, you're good, there's nothing wrong with you, it's okay," and so where does stigma start at what age?
So look, I think kids will be. I think part of normal development. Young people will start to learn that they can tease and call each other names and sort of make fun of each other and so on. Like I say, there's always a thin line between what is playful and sort of mischievous, sort of banter between young people, and then what then is something that starts to have a negative impact on a young person. Now, it can start as early as 6, 7, or 8, and you will get teased for being too short, or too tall, or too fat, or too thin, or not clever enough, or not sporty enough. So these are all things that start to happen at 6, 7, 8. And what if you have the latest Labubu, or if you have the latest Stanley, and all of those things. Now, I think it's then important for parents and teachers to be mindful and aware that young people as young as 6, 7, 8 can have that some of these things can have feelings, can have an impact on their feelings, and to then keep pick up on any change in behavior. So if a young person is usually chatty and bubbly and they go quiet, then that's a sign something has changed. And vice versa, if they're normally quiet, but all of a sudden now they're just a bit more vocal and a bit more loud. And so any change, whether it's in appetite, in sleep, in mood, that is not necessarily pervasive, but that continues for a long enough period for there to be some concern, I think there needs to be an intervention or a step taken towards addressing this openly and talking about it with the young person, and then taking necessary steps. Yeah.
Are there specific mental health conditions in childhood? Like, are you like real conditions that we can learn from, change in behavior? What could that be? Do we label it? Do we don't we label it? What are the terms that we usually use here?
All right, so that's a good question. So you can think of it on a number of different levels, but essentially, or very, very broadly speaking, in the world of mental health, we will think of things as either developmental or neurodevelopmental. So these are essentially things that the young person is just in their hardwiring.
Mm.
That means that they have a slightly different approach to things, and you would be able to see those as early as 3, 4, 5, 6, and so on. And those would be things, for example, autism is one of the things that you can start to see as early as that.
Mm.
We tend not to rush in with diagnosis because it doesn't, unless a diagnosis serves to help things, it sometimes, it's if not used correctly, it can actually get in the way and hinder things, and you lose engagement with the family and so on. But things that we would see in children tend to be more neurodevelopmental, so ADHD, autism, learning difficulties, oppositional defiant behaviors, and so on. And then as they get into maybe their early teens, so, 10, 11, 12, you can then start to see anxiety, depression, eating disorders, body image issues. And then certainly in adolescence or later adolescence, they pretty much behave like adults. So you can see things like psychotic disorders, substance misuse, and so on. But you can certainly see. I think it's a misconception to think that young people don't get mental health problems. It's like saying young people don't get thyroid or they don't get, any other medical condition. Yeah.
Yeah, absolutely. All right, so I'm gonna go a little bit into the schools and educators ecosystem, given we're Elgo, and let's start it off with like, what do you think is the role that the school can realistically play in disrupting, the mental health stigma that is, very dominant in our region?
All right. So look, we agreed to do this in English, but with everyone's okay, I'm going to say one thing in Arabic and I will translate it. So and actually I've taken this from a mom that I saw once in the clinic, who came and said, the school keep calling me every time my son does something in school, and I don't know why they just don't manage it themselves. So this was a discussion that we had. And so she said, doctor, historically, as you know, the ministry used to be called in Arabic وزارة التربية والتعليم, and they put التربية قبل التعليم. So in English this is, so the ministry isn't just the Ministry of Education or ADIC, it's almost تربية is more upbringing and education. So the schools have a دور تربوي قبل ما يبقى دور تعليمي. So it has a role in being teaching young people respect and hierarchy and understanding rules and social constructs and so on, not just teaching them math, English, physics, and chemistry. So there's definitely a role, and I think most schools have adopted that ethos in their practice. All the efforts that we see now, like Elgo coming into schools, like efforts from ADIC and the DOH and AD, the public ADPHC, making sure that school staff and school counselors and that mental health is part of the curriculum. It's not just an optional add-on, or shouldn't be at least an optional add-on, but that actually, if the students in the school aren't in good health, both physically and in terms of mental well-being and resilience, then you can almost be sure that they're not going to perform well in their education, and they are going to be missing out on schools, and their school experience is going to be not a particularly healthy one. So, yeah, so I think, like I said, efforts like you're doing and embedding mental health curriculum as part and parcel, and teaching students how to look after themselves and their emotional well-being, in my view, is as important, if not more, than teaching them French or physics or, any other subject that they might take here.
Yeah, absolutely. Luckily, like we're seeing this big major shift, in the region on integrating mental health education as part of the curriculum, because now we have realized, post COVID, that we really need to be learning these tools, that can help us take care of ourselves first. Otherwise, we will not be able to achieve
Yeah.
much. So, like, if we're like looking at the school from the outside, like, where do you feel like mental health stigma is often hiding, within a school? Like, is it in the senior management? Is it with the teachers? Is it with the students? It's with the environment, the bullying that's happening. Like, where can we find it if we're looking for it?
I think at every level, Myrna. I
Mm,
think at every level. I mean, I appreciate there's a lot of effort and a lot of work that's going into shifting attitudes towards mental health. But
mm,
from my day-to-day practice, I still see it at every level. So, for example, maybe schools will raise concerns that a young person, so I'll give you an example, for example, around ADHD, that sometimes if the schools don't have a strong ethos around supporting mental health, ADHD will run for months, if not, longer, seen as this person is naughty, they are being disruptive, they are the class clown, they are failing academically, and so on. And you're like, but have you checked for ADHD? Has anyone had the conversation that this might be something else going on? Has anyone asked if something's happening at home? So instead of having a negative connotation to the young person's behavior, I was like, I wonder if there's something else going on.
yeah,
So schools that then do refer, they will speak with the parents, and the parents will come to us in the clinic and then say, but don't share the results with the school. I'm
yeah,
like, but this is because then some families think, well, if we go back to school and say, yes, this young person has one, two, three, and four, that this might then possibly jeopardize their position or weaken, So there's still, and on the student level, they still don't want to be, they don't want it to be known that maybe they're going to the school counselor back and forth and maybe taken out of certain classes and so on and so forth. So I think, I've given, just in all fairness, I've given probably the worst example of what we're addressing it, but because there are then schools who are doing an absolutely fantastic job where, mental health and mental well-being is celebrated in the school, and where the teachers are absolutely understanding and the school counselors are doing an incredible job, and parents are open to coming and sharing information and so on. So I've given I've given both examples just for people, to give a balanced view, but I think that other side still exists, and I think that's why we're having this conversation. Everyone who's already doing a great job, continue all the great job you're doing, but there's
yeah.
certainly a lot more work that needs to be done here.
Yeah, I believe we're trying to break those barriers. And first and foremost, it's about actually talking about it and normalizing the conversation as part of like our everyday. So I know we have a lot of teachers here, and this will be the last thing about schools, and then we'll go into the family. So what is one simple thing you believe teachers can do, this week or any week, just to reduce the stigma in their classroom, to try to help us in our mission.
I mean, I think, I genuinely think mental health shouldn't be a token day. I mean, I appreciate it's a week of this, but I think if it's just a pop-up that comes up once a year or then it's not going to have the long-lasting effect that we hope. And I genuinely think it should be weaved into and embedded in the general ethos and the curriculum of the school, because then it keeps it alive, and young people don't suddenly come up with an issue this week and then they're perfectly fine the rest of the year. So there has to be continuity, and it has to be embedded as part of the school ethos that we are here, we are open to conversations, that everyone is welcome, that there's no judgment, and more importantly, that we can help and we can manage, and that there are systems in place and services available. Um, if people don't feel that, well, what's the point? If I go and talk, what's going to happen? So I think, certainly I've been in the UAE now for 10 years. The shift that's happened from when I first came in 2015 to now is an incredible shift in the landscape, both in terms of the amount of services available, the quality of the clinicians, and just the awareness and the systems in place to support young people and schools and families.
Yeah.
So, yeah, I think schools can always bring in people to talk about. If they're not going to do it themselves, then there can certainly be like a rolling program
Excellent.
of
Yeah. Yeah.
bringing in people to talk about things, and in different disciplines, psychiatrists, psychologists, different relevant topics particular to school, have the training for, or have these talks specifically aimed at the students, maybe aimed at just for the parents, and
Yeah.
sometimes maybe aimed just for the teachers and the school staff. So you're always addressing things in a systematic way.
On different levels, for
Yeah.
sure. So I'm gonna go back to parent realities, and it's where usually it gets more complicated because, as you know, like Arab parents are very loving. We have this sense of community. It's very big. We are proud of it, and that's why we do what we do at Elggo. Making it more culturally compatible to the region. But we feel like parents are still afraid. So, like from your experience, like what do you feel like is the top thing that parents are afraid of when it comes to mental health?
Um, I think they're afraid because maybe a lack of awareness or a lack of understanding, or a
Mm-hmm.
misconception, maybe, or a historic misconception of mental health. So if you take you and I, for example, we might know anyone in our social network or families who has been to an eye doctor, or maybe has had heart surgery, or has definitely, had an X-ray or a CT scan, and they've had, and so it's a conversation that you're familiar with, that you know something about. But I don't know if many people will know someone in their social network or family who has necessarily been to a psychiatrist or mental health professionals, because it tends to be something people don't talk about. So
Yeah.
there's quite often a hesitancy
Mm.
in families, unless things are, significantly concerning, of, I'm not sure if I trust you enough with my daughter or son.
Yeah.
We've only just met, and why do you want to talk them without me in the room? You know,
Yeah.
you sometimes, what is it that my son and daughter feels comfortable telling you?
Yeah.
We've
But
just
not.
met them, that they don't feel comfortable saying to me. Do you see
Mhm.
what I mean? And
Yeah.
particularly when you put that in a context of anything that your son or daughter and I talk about is confidential, it doesn't sit well with lots of
Yeah.
it doesn't sit well. And so that bit, I think, is an art of putting the families at ease, that we're all in this together, that there's no different teams. We are all here for the well-being of the young person. But that's what we do, and this is how we do, it's almost a trade. It's our trade to feel the young person can come in and share everything that they want to share, and feel that this will stay within the containment of the therapy room. And then we then, we let parents know broadly what's happening in the plan. We don't exclude them, but we don't go into detail of he said, she said, and so on, because
Yeah.
then, it sort of, we don't breach that confidentiality unless it's absolutely necessary to do so in case of safety and risk issues.
Yeah, I totally understand that because I feel like sometimes the parents are afraid that the kid will say something bad about them.
Yeah.
Because most of the time the core of the issue is coming from something related to a family issue or, a communication issue or whatever. And they're afraid, my kid is gonna go to the psychiatrist, and then in Arabic we say bahdilna, like he's gonna say everything about what's happening in the house, and then, we're gonna feel shame and guilt, and we're working with doing these awareness sessions just to try to have a better conversation with the parents, that it's okay if the child is saying something about you because he is feeling a certain way, and we can, overcome it together. I feel like this is, the core of what we face when it comes to stigma.
Yeah.
Um,
I mean,
going, yeah,
on that note, Tamerna, we will obviously see the entire spectrum of presentations, behind closed doors.
yeah,
So there are absolutely times when we feel actually there is a major issue at home,
yeah,
that, maybe we need to alert safeguarding concerns and get social services in, and actually this is not okay. And so
yeah,
those situations definitely do exist. But
yeah,
for the bigger part of things, we will always tell the parents, you are not the problem.
yeah,
Neither is the child, because you sometimes get it the other way around, where the parents come and say, he's this, he's that, or she's this. And so we say, you are not the problem, neither is your son or daughter the problem, or there is a problem. And now we are all part of that solution. So, it's not a question of, the cliche is you're not part of the problem, but you're definitely part of the solution. So,
yeah.
what is it that you can do? What is it that this young person can do? And how is it that we can help to try and get you past that particular issue or challenge that you have
Yeah.
here?
It's kind of like reframing the problem solution kind of.
It's no one's fault. Yeah, yeah. There is, it's no one is the problem. The problem is the problem. And then let's see what we can do to try and address this here.
That's the best solution, always solution oriented. All right. So, in our region, we have heard a lot of, Muslim parents fearing, that teaching mental health will make their child rebel or move away from the faith, or, like this does not go hand in hand with Muslim teachings. What's your stand on that? Like, what's your opinion about it?
So again, I think it maybe stems from a lack of understanding and a lack of education around what is it that we do.
Mm-hmm.
Again, coming back to the point, if you go and see a dentist or an eye doctor, a lot of what we do in mental health, whether it's psychological approaches or therapy, and with all its different forms, or medication, are all embedded in really common sense practice and support. So, if a young person is, for example, engaged in mindfulness, or they're doing cognitive behavior therapy, or they're doing behavioral activation, and so on, none of this competes with any of the faiths for that matter. It's got nothing to do with religious teachings. If anything, we would include religious or spirituality in any form into that recipe, if you will. So if you take, for example, someone with depression, and we would say, well, how about doing fun things you really enjoy? How about eating well? And let's look at your sleep, and let's look at your and then you do talking therapy, but then you do a bit of spirituality and maybe consider a bit of medication. So it's almost a recipe or an ingredient for a success story.
Yeah,
None of those things on their own is going to be the deciding factor. So it's not going to be that you should just, have stronger faith and go and pray. That in itself doesn't do it. And if I share a personal experience from when I trained in Egypt, we would bring in faith healers of all, we would bring in a priest and a sheikh to talk to people about spirituality and so on. And I think at one point there was a bit of a commotion in the ward, and I think how it was perceived is that the person of faith then said, or the religious person almost implied that the reason these people are depressed and in hospital is because they have veered away from
they're afraid.
religion.
Mm.
And that if only they were able to find their way back, that they would feel so much better in themselves. So you imagine saying this to a group of people who maybe had substance misuse problems or maybe feeling depressed. In addition to the issues that they already have, they then started to feel, on top of all of this, I'm
Mm.
not a good Muslim or I'm not a good
Yeah.
Christian. So
Mm.
further increased their guilt. And so there was a bit of unrest. So a lot of the time, it's not what you say, it's how you say it. So
Yeah.
we absolutely encourage people to find spirituality and seek a higher meaning to things, in addition to the CBT, in addition to the sports and the activities, in addition to a meaningful relationship and so on. Because put together, then you see a shift and a way forward. We
Yeah.
would never say, you know, therapy is the only way or medication is the only way, but I certainly don't think religion is the only way either. I think once you put it all together, then you see, you know, it's the technical term, it's the accumulation of marginal gains. You know, you each one of those gives you a bit of a gain, a bit of a step forward, and when you put them all together, that's when you see a change for the better.
Yeah, but it's like if we're looking at well-being, there are different aspects to it. It's the mental, the spiritual, and.
Yeah,
So,
and
it can't
social
be
and
just what,
physical.
yeah, exactly.
That's
So
it.
it can't be just one thing. And, if we teach kids now in schools like about well-being and mental health and the tools that are available, because, it's not just mindfulness, there are other tools that, are accessible for these kids that they can use. We are empowering them not to rebel against you as a parent, but to have a better, I feel like, experience or a relationship with you because they understand themselves
Yeah,
better. So,
I think the rebellion probably comes if the parents then try and undermine that approach. So,
yeah.
for example, the young person is doing breathing exercises and mood diaries and what have you, and learning a few tricks. And then the parent comes and says, "This is rubbish. You know, what are you doing? This is nonsense. You should just do, you know, for example, go in and pray." there,
Mm.
there might be a bit of a pushback at that point because the young person is presumably getting something that the person is. But I think if the parents are more informed and they are more aware, and actually if they try it themselves, so often, you know, it's we can all do with a bit of mindfulness and talking to someone and being grateful for things and so on. Then I think I think it sometimes, you know, historically, um, being against something often is in the context of being not as informed about that thing or having a misconception about that thing. And then if you understand it a bit more, you think actually it blends in well with what I'm trying to do here.
Yeah. So how can we like bring the parents into this conversation without making them defensive? Like what's one strategy that has worked that we can learn from you now?
Um, I think I think the starting point, you see, the schools are an incredibly powerful position because, in a way, they have captive audience. You've got
Yeah.
you've got students that come to you on a daily basis, and and you have parents that you engage with on a daily basis through parents' evening, through things that you. So I genuinely believe school is where it all starts. Uh,
Yeah.
and so anything that we can do through education and through schools, people will be reluctant to come to mental health. You know, we're almost seen as a tertiary service. So, you know, once they've gone from school, pediatricians are another point where people go freely because everyone sees the pediatrician for something or another. But I think schools is where it mainly happens because it's actually a place where you're observing students for a good part of the day from, you know, for the and so it provides vital, you know, observations by teachers to parents. We've noticed that, you know, your son or daughter has been one, two, three, and four. And so it just allows for that. So I think engaging parents through school programs and through school activities and a schedule of some sort is going to be key. It's a very
Mm.
non-threatening, non-confrontational. We're raising awareness. I want to talk to you about how well he's doing in his maths, how well he's doing in his biology, and how well he's doing in himself.
Yeah, yeah. I feel like at Elggo, like one of the things that we're hopefully this is our first webinar. We're we're very happy to have you today, but we're gonna do more webinars to talk about how to speak to parents from different, backgrounds, especially when we talk about UAE. We have so many different nationalities, so many different ways of approaching mental health, and how do you mix all of this, in one key takeaway. And today we're just going to focus on, removing the stigma and things like that. But if anyone, has any question, please drop them, or you can even open your camera. We wanted to make this, more interactive. So please go ahead. Like, we're gonna give you time for your Q&A, and I'll continue with Dr. Khaled. So I'm really trying to get into different nuggets of wisdom from you, Dr. Khaled. We only have this hour with you. So if we can train every teacher in on one mental health skill, what would it be? Like, what's the most important skill for us?
Oh, that's a hard one, Myrna.
I'll
This-
ask you another one if you want to think about
no,
it. But
no, no, no. I'm thinking, in that I'm reflecting on my own children. So conversations I've had with them. I think if I think teachers need to be, or the young people need to feel that teachers are accessible and that they can talk to them about essentially anything that they are struggling with, and that because without that initial step, I can be someone who's very observant and see that this young person has gone quiet and so on. But there's something about, active listening and being accessible that just allows the young person, it's almost a push or pull. Do I go out and ask the person and make sure and pick up on anything that they're doing, or do I invite people to come to me and talk to things? And so I know from my own, kids, that there are teachers that they will go and talk to them about, who has a crush on who and who is doing, all the stuff that you would expect in your teens and adolescents, and others who they don't feel that relationship with. So I think active listening has to be the starting point. And then I think, you acknowledge, you contain whatever the young person comes to you with, and then having the ability to then knowing what to do with this information, who you pass it on to, how you then manage.
Probably it's about also, like, I feel it's the mindset of the teachers. We're there to teach, even if I'm teaching math or science or whatever, I'm also a role model for these
Yeah.
kids, right? So it's about my approach and how open I am, and how, like, if somebody comes and like tells me something, what do I do with it, and how do I create those pathways for them to be able to feel safe first and foremost. I feel like that's like one of the most important things that I can provide as a teacher to make sure, our kids are healthier and in better environments.
Yeah, and we
So,
say the same thing to parents, by the way. So, parents
yeah.
say, "What do I need to do?" And I'm
Mm,
like, you have to keep the communication channels open. If the
mm,
communication channels are not open, you really have no way in. You have
yeah.
no access to. So
So
yeah.
it's so true. So we have two questions. So we have a question from Dina. She's asking, is bullying a great factor in mental health issues the kids are facing? Why and how? Yeah. Uh,
So yes, is is
we need
the
a session on bullying.
yeah. And there's so many reasons for bullying as well. And it's again, if we think of things in a systemic way, you almost want to think of things in the young person themselves. Actually, the person who is, the perpetrator, the person who's doing the bullying, and the victim who's being bullied. There are characteristics in both that then mean that this dynamic is happening or maintained. You then think of the family. Well, what is happening in the family, the household of the bully, the person who is doing the bullying? Is he seeing, for example, you mentioned role model. Is the role model in their household is when I'm frustrated, I take it out on those around me? Is there violence in the house? And then you think of, what is the school role? So in any issue that you address, you always think in the systematic way of, the what's happening around the child, what's happening within the child, and what's happening within the immediate surrounding, and then wider. It has implications, huge implications on kids in terms of anxiety and mood and sometimes self-harm, school refusal, impacting, the amount of times that we will see young people coming into clinic with academic decline, and parents will say the grades have gone down and they're spending too much time in their room and they're not coming out to dinner and so on and so forth. And then, but the underlying core of all of this is bullying at school. And as
Yeah,
you know, bullying takes different forms between boys and girls. Girls are a lot more meaner than boys in bullying. With boys, it's more physical. We fight it out. It's a bit of testosterone and it's sort of, it comes out in that way. Girls are a lot more, it's a lot meaner because it's all about spreading rumors. And I saw someone recently who said, oh, that she was, maybe having sex with other boys, and the reason why she was off sick is because she was pregnant and had an abortion. And by the time you try and rectify and address this, and then inevitably she started missing out school, and then her grades dipped, and so the parents are not happy with all of this, but not knowing the full story. So you can see how it spirals then into, a significant issue all stemming from bullying and it's either spreading rumors or exclusion is the other thing with
yeah.
girls.
Yeah, like this example is very extreme, but we've seen, softer things happening, and especially when we're talking about the Arab culture, because a lot of the language that we use as adults and as parents is very heavy and very intense. So kids usually replicate that in school settings, and it affects, the other kids who are maybe hypersensitive or more sensitive than they are in different ways. So we can take it from the minimum to the maximum that you
Yeah,
mentioned.
yeah.
Thank you. So, how far do online games like Roblox, Avatar, and other games affect mental health, children's mental health?
Really good question.
Yeah,
Uh,
we
I
need
I
another session on this too.
No, no, no. I'll be concise. I personally, and I don't know if it's controversial or not, but I personally don't necessarily have an issue with screens. Now,
Mm,
it depends on the age. And I will give the example that, myself and maybe a lot of people on this call, we might end up spending, certainly if you work at desk office, 10 hours a day in front of a screen. Now, you
mm,
can argue this is not a healthy amount to spend sitting down in front of a screen, but I'm using it for research, I'm using it for work, I'm researching things online. So I'm using it for the good. So the screen itself is not the enemy, but the content is the enemy. So
mm,
if you have young people who are spending time on their screen in their adolescence and they're researching things and they're doing papers and assignments and so on, not a bad thing. If they are spending it doing gaming and Roblox and all the other things then that is not a good thing.
mm.
Now,
It
interestingly,
really depends, even with that. Like, have you heard of this kid or like adolescent that committed suicide in Iraq because of Roblox? Even within the game, there are
yeah,
different games that you are playing and how it affects the kids' mental health. So,
look, I'll tell you, it's never in mental health. It's never a linear thing. It's never one
yeah,
thing led to the other. There will almost have certainly been lots of predisposing factors and lots of
yeah,
environmental factors within the child and the family and the environment and so on that then led him to be engrossed into these games and then do the act. Um, so certainly screens are not a good thing if you're, I just don't want people to take the message that I'm okay with screen time. I'm just saying, depending on the age, if you're 3, 4, 5, and 6, you shouldn't be spending time on screens or any long time on screen. You should be out playing, experiencing life because you will learn so much more from life by living it than by learning about it on a screen.
yeah,
If you're an adolescent and you're using it for research and university appointments and so on and so forth, it's kind of okay. So the balance is, the issue specifically with Roblox and games is that immediate hit and reward that you get from the quick dopamine hit that you get is akin to addiction. It's what
Yeah.
happens is your system gets overwhelmed, so it starts to upgrade and almost create more receptors, if you will, to receive all that dopamine hits that are coming. And so when you're no longer on the game and you're no longer, you have all these receptors and dopamine receptors that are not being stimulated by anything. So you're constantly feeling bored, you're not paying attention. Nothing that the teacher can then do in class will be stimulating as much as the flashy lights and the sounds and the noises. And so that's where the problem then happens. And so that's why you then find kids rushing back from school to go back online to almost fill up the, those dopamine hits
Yeah.
that you want. So there is something definitely concerning if you spend prolonged hours on screens playing these high intensity games because of that sort of almost chemical and then structural differences and change that happens in young people's brains. Particularly if you're young, the brain, there's this neuroplasticity, the brain is shaping and forming as you grow. And if you're sort of bathing it with all these hormones that you're getting from that excess stimulation, I think the sounds and the colors and it's just a very hard, it's a heightened state to be. So yeah, Roblox and all the other games, not good.
I
In small doses, yes. There's nothing wrong with half an hour of something that gives you a bit of fun and excitement. But that's a full
I
question as well, as
yeah.
you say, because to replace that, you need to engage the young people in something that is equally thrill-seeking. So if I say get off your iPad and go and clean your room, this is a lost argument. If I say get off your iPad and come with me to the beach and let's go for a swim, or let's go on a hike, or let's do something remotely exciting, then you have a fighting chance of getting your kid off the iPad. But
Yeah.
go and take the bins out or clean your room is just not going to do it. Yeah.
It's part of their household chores.
Yeah, yeah. It's not. It doesn't compete. It doesn't compete with the
Yeah.
games. Yeah.
I feel like we can't have enough time with you, but we were planning 45 minutes. We already exceeded our time.
Uh-huh.
We won't be able to answer all the questions right now, but I'm hoping we're gonna do more sessions and more sessions specifically about bullying and the use of social media and how do we manage that. But I feel like our key takeaway today is how do we find the balance for our kids, for ourselves first, and then the kids within the school. And how do we remove the stigma and have more open conversations? So to end this, if you had one simple daily question a parent can ask to check in emotionally with their children, what would it be?
I mean, there's so much we could have we could have mentioned, Mirna. I think the classic thing of you ask your kids when you come back from school, how was your day?
Mm,
They will say, well, it's,
good.
you won't get the answer there. And often the conversation will happen just before bedtime, as you're tucking them to sleep or as you're falling asleep, and they will casually say, oh, this and this happened. So I think the idea is to be always receptive and expecting or to invite a conversation. Now, one way of doing that is modeling. So
Mhm.
if you then say, "Oh, I've really had a brilliant day today because I did one, two, three, and four," then you're inviting the other person because you reciprocate. You're inviting the other person to say, "Oh, I did really well in maths today." Or if you say, "Oh, it's been a tough day because there was this interaction I had with a colleague or something happened," how about you? So if you model and you almost put out first, then it's an invitation for them to then reciprocate and share it with you. So you're coming at it from a we're sharing rather than I am the parent and I'm inquiring about how was
Yeah.
your day? You won't get much if you do it in that way.
Yeah, or sometimes like what is one thing that happened today that excited you or made you not like not like how are you? We always get the same answer. It's like I'm
Yeah,
fine. So,
you can. I mean, there's all these things of, I always say, what have you learned today?
yeah.
So they'll say, "Oh, I learned about volcanoes and so on." And I try to push my kids, "Oh, but what if you learned other than the, you know?" So it's usually then the conversation goes into kindness, or, well, this person wasn't happy when that person didn't sit next to her in the playground, and so this, and then we have that conversation this way, and you almost use it as a learning opportunity. So I think what if you learn today is something that fits in with school, but also you can bring it into what have you learned about yourself or someone else or the teachers and so on. Um, I think that's
Amazing.
a good question. What have you learned today? And then you can get into, according to the age, of something you've been very proud of, something there's so many different questions you can then ask them. Someone says, I see I've got some excellent. Ooh, no, this was someone saying they got good advice.
Uh,
Hi, Luma. I think we're frozen. So I think maybe there's some technicalities on Myrna's and Luma's end, but I don't know if people are still here. Anyway, it's been absolutely wonderful connecting with Myrna and Luma. It's been wonderful having people call in, and I hope it's been helpful. I think there's a plan for this to be a series of events. Oh,
Sorry.
you're back, Luma. Hello.
Yes,
there we go.
we're
We're back.
both back. We're both in Lebanon and like
We have a
like
lovely timer,
Italia.
electricity.
All right. No, I was just saying it's been absolutely wonderful to have the time to speak to the both of you on this really relevant topic. I hope the audience got, even if it's just a few nuggets of things that might be helpful. And I think the plan is for this to be a series, one of many to come, which I'd
Yeah,
be absolutely more than happy to like you say, each topic we've talked about today can be a talk in its own right, and we can do a bit more of a deep dive in some of the
flesh them.
issues around bullying and maybe screen time and how to manage and so on.
Yeah, yeah. Thank you so much, Dr. Khaled, for being our first speaker on our first event, and thank you everyone for attending. Hopefully, the video, the recording will be up on YouTube. We'll share the link with everyone. You can, watch it, send it to whoever you would like, and we hope to see you again soon. Thank you, and bye,
Brilliant.
bye,
Thank
bye.
you. Thank you, man. Bye-bye.
Thank you so much. Have a great day, everyone.